Half of all new sexually transmitted disease cases in the United States occur among those between the ages of 15 and 24. We have asked Marianne Adolf, supervisor for St. Charles County's STD clinic, to describe efforts in our community to prevent these diseases. Marianne, thanks for coming in today.
Thank you very much for having me, Doug. I appreciate coming.
The St. Charles County STD clinic offers a number of services. Can you talk about what those services are and where you can get them?
Sure. Well, first of all, we're located at 1650 Boonslick Road, and we have appointment visits for STD testing. And in the clinic, we can test you for gonorrhea, chlamydia, HIV, and syphilis. And in addition to doing the testing program, we also have a very active education program. And so I go out into the community and I will visit groups of generally teenagers, but we are available for any group. And we talk about STD prevention and the prevalence, not only just in our county, but also nationwide.
And you mentioned a few of the diseases that you treat. Are those the most common sexually transmitted diseases, and what are some of the symptoms that people may have if they...
Those are the four most common. There are quite a number of others. Generally speaking, what we see in our clinic and what we see in the county and in the state of Missouri are things like gonorrhea and chlamydia, which are bacterial STDs. So we treat and cure those. Often both men and women never have any signs or symptoms of those infections. So it's very important that anyone who is sexually active, in particular those people who have more than one sexual partner in a year, that they have an annual screening for those two bacterial STDs. And then we also see another bacterial STD, and that one is syphilis. Low numbers for that, but from time to time we see spikes in this area and also nationwide. And then we also screen for HIV. Now the prevalence of that in St. Charles County is low, but we do recommend that anyone who is practicing unsafe sex practices or who has multiple partners have that screening done as well.
And you talked a little bit about what your staff does out in the community to help prevent STD transmissions and just general talk about prevention things. What are some other things that you do, and what are some things that individuals themselves can do to prevent the spread of STDs?
Well, the first step to avoiding STD is to educate yourself about them. You can get information from our clinic. We provide brochures to anyone who walks into the clinic. Then we also recommend the Centers for Disease Control website, and that's www.cdc.gov. It's a government website. They are the authorities on STD, and they help to guide our practices. And then people also need to be aware of their own bodies to understand what happens when you get an STD, what signs and symptoms might be occurring, and then know how to access services such as those in our clinic.
If someone is concerned that they may be exposed to or even infected by an STD, what are some things that you as the STD clinic can offer as treatment, and what should they expect for that first appointment? You did mention that it's an appointment basis, but what should they expect for that first visit?
It is an appointment basis. Generally speaking, we have clinic hours on Monday, Wednesdays, and Thursdays. We do some other visits on Tuesdays and Fridays. Once you come into the clinic, you will have the obligatory paperwork that you would in any kind of a facility. We'll gather some demographic information about you. Although our services are confidential, they are not anonymous. We do need to have a means for being able to contact you if your test results come back positive. Then after that, you will meet with the nurse who will continue to gather some additional information about your past physical history and health history and any sexual practices that you may be engaging in. From there, she will do a blood draw, and that will test for syphilis and HIV. I must say that the nurse that we have in our clinic is one of the best nurses that I've ever worked with, and she's always complimented on how gentle she is with her blood draw. People, for some reason, are always afraid of needles, and we understand that. So the area that we utilize for the services are very comfortable, aesthetically pleasing. I think that everyone who comes into the office will feel very comfortable, not only with our nurses and our staff, but also with the physical surroundings. Once that blood draw has taken place, then I step in to do the examination for men and women both. We see people from ages 13 on up. There's no limitation on the upper end of the age as to when people may become exposed to STD. For men, we provide a culture for both gonorrhea and chlamydia. For women, gonorrhea and chlamydia as well, along with a pelvic examination. And also during that time, I'm doing a generalized physical assessment of other things that might be going on in terms of anything like genital herpes or genital warts, any other lesions that might indicate the presence of STD.
And one more time, if someone was interested in getting some services with you, what number should they call?
Real easy to get in touch with us, 636-949-7401. You will have a menu to choose from, first one being directions and hours of the clinic, press 2 to talk to the secretary and to make an appointment.
Thanks a lot, Marianne, for this information.